For our Culture Safety project, we are focusing on the National Patient Safety Goal of using medication safely. Safe medication administration is important because medication errors can result in complications and even death in our patients. We are going to discuss the policy in our clinical facility, Toby Hospital, our observations of this policy, and our recommendations to the facility about how the policy can be improved to help administer medications more safely.
Any RN or LPN that is considered competent can administer medication under the South Coast Healthcare System policy. Student nurses can also administer medication under direct supervision of their clinical instructor. Clinical instructors will have access to the Pyxis and the Electronic Medication Administration Record, or EMAR. The instructor will then supervise the student administer medication and make sure the student is administering medication correctly and accurately. Students will document medication administration under supervision of the clinical instructor, and then the clinical instructor will verify the administration of the medication by the student was accurate and complete. Aseptic technique will be used in the preparation and administration of all medications, regardless of the route. Documentation of the medication in the EMAR is listed as given or not given. Given indicates that the medication was administered. Not given indicates that the medication was not given and that the RN or LPN will indicate the reason for the medication not to be given. Examples for reasons the medication would not be given are the patient refused or blood glucose parameters for administering insulin. If the patient is on a sliding scale insulin and they do not need insulin according to the sliding scale, the nurse would not administer medication and she would have to document it as not given and list the reason why.
Medications are only to be administered after an order has been placed by the physician. Orders can be written or electronic. Medication orders, written or electronic, will include the generic or brand name of the medication to be given, the amount of the medication, the route, the frequency of the medication should be administered, the times to give the drug, and the date of the order. If an order is incomplete or illegible, it is up to the pharmacist or RNs to clarify the order with the physician.
Before dispensing medications, RN must verify that the medications to be dispensed against the original order from the physician. As each medication is removed from the Pyxis, RNs are responsible for checking the Pyxis and making sure it matches up with the order and with the EMAR. Medications are to be dispensed one at a time, and the RN is to be cautious of keeping the package intact until they are all scanned and opened in the presence of the patient. Before an RN can administer medication, they must be knowledgeable of the drugs that they are about to give. They must know the reason the drug is being given, the proper dose for the patient's age and weight, the intended response of the medication, the contraindications or the reasons not to administer the drug, allergies of the patient, incompatibilities of the drug, and the possible routes for administration. Lab and vital sign results that may impact the amount of medication or whether to withhold the medication are also important, and the pregnancy and lactation status of the patient could lead to undesirable effects in certain medications. Nurses must follow the 6 rights of medication administration, which include the right patient, right medication, right dose, right route, right time, and right documentation. Nurses will bring the medications to the bedside of the patient and perform proper hand hygiene. Then they will ask the patient for their name and date of birth. They will compare what the patient said to the ID band of the patient and to the EMAR. Then nurses will scan the bracelet and verify that they have the correct patient on the EMAR. Then each medication is scanned and noted in the EMAR. Depending on the medication, nurses may have to put information into the EMAR before being able to give the medication. For example, if a nurse is administering a blood pressure medication, they will record the most recent blood pressure of the patient in the EMAR to make sure the medications should still be administered. After reviewing all of the medications, the nurse will open the packages to examine the medication. The nurse will administer the medication to the patient and document the administration. Safety issues are related to not following the 6 rights of medication administration.
The 6 rights of medication administration are in place to keep the patient safe, and not adhering to these can result in medication errors that could potentially be fatal. For spending time in hospital, here's some observations that we saw. One of the most important ones was the patient was rarely not given a chance to ask questions. The nurse was in a rush, and the patient was not able to understand why or what the medication they were taking was doing for them. Another observation was that the nurse themselves were not able to explain to the patient why they were taking that med. Documentation, another observation was that documentation often occurred after the actual administration, which increases the chance for error.
The main safety situation about medication administration is making sure it is the right patient and the correct medication, but also the correct dose. As a nurse, you should always use 2 identifiers to make sure you are giving the correct medication to the correct person. Although there are name bans and the facility has to scan everything, it is also a good idea to make sure you ask the name and date of birth from the patient if you are able to. You should always make sure you are giving the correct dose. Dosing involves math, and even though it can be simple math, it is always a good idea to double check to make sure you are administering the correct dose decided by the doctor. Being a patient and not understanding what medication you're being given is huge. It is always a good idea to allow the patient to ask questions. You should also tell the patient what each medication is and why it is being given. Asking the patient if they have any questions about their medication is also a good idea to do beforehand, because sometimes a patient may refuse a medication. It is much simpler to know if they are going to refuse it before you take the medication out and then end up having to discard it. As a nurse, you need to have basic knowledge of each medication you are giving the patient. By having this basic knowledge, you are able to catch on if there is a mistake made or if the patient is having an adverse reaction to a medication. You will also be able to know what signs and symptoms the patient may have and things you need to assess for patients on certain medications. For documentation to be done correctly and accurately, it should be done as soon as the medications are given. We recommend that the facility monitors med passes. And lastly, we suggest that the facility give an in-service to staff to remind them of the importance when it comes to medication safety and administration.